year. As far as this year's budget, very similar to last year's budget. A couple line items changed. We increased our insurance allowance as we have some rates going up, and offset that by decreasing some repairs and maintenance. And because we was able to finally pay our line of credit off, that line item has been removed, and actually it's going to help us continue to build some reserves. And I'll take any questions you might have.
Ms. Cloley.
Thank you, Madam Chair. The budget detail that we have received, it doesn't include any revenues. I think it's mostly expenses and capitalization, I guess. Your fiscal year, does it run January to December?
June.
June. So the 2021 would have ended in June.
Right.
And
That budget is just expenses. You're correct. And the millage revenues equal the amount of the expenses there.
okay, your percentages, I think you're showing your statement of activity that it's 100%.
That's only millage monies. That's not incorporating the other monies of the organization.
Right. All right. Thank you.
Yeah. We have audited financials we can provide you. We have internal financials that show we have a set with the millage and without the millage.
Ms. Perrier.
Thank you, Madam Chair. I see where the line of credit falls off on the 2022 budget, and then there's a new line item, additional funds received. What is that?
We got that answer today. It's actually monies that were for last year's millage that we didn't expect to receive that we did receive. So actually, we learned that today. We weren't sure what was going to happen with these funds. So actually, as of today, that would be an increase in the investments account line item. Instead of 150, it'd be 190.
Okay, so that's not an expenditure. I mean, what it's titled made me think, of course, it's not an expenditure, but that's revenue. Okay. I appreciate that you've always taken into consideration the little things we ask about how we'd like it presented to us. I know it's sometimes a working document for us, a living document. So and I don't know if maybe there's something that can be done to kind of alleviate what Ms. Mary's questions were. I know we don't have to see that other side of the budget necessarily by law, but maybe there's some way to kind of incorporate it into the future budget presentation so we know
Sure.
big picture a little bit more.
Absolutely.
Thank you.
And I'm sure that audit reports available on the legislative auditor website as well. Yeah.
Any more comments or concerns? Council? That's it. Thank you, sir.
Thank you very much.
Can I make a statement? We could send whatever additional documents that's needed at any time, so I just want to make that statement.
Okay, thank you. St. Charles Housing Authority, Ms. Leatrice Hollis.
Good afternoon, everyone.
Good afternoon.
How are you guys doing? Thanks for inviting me once again. And I don't know what it is, but whenever I come before you guys, I have an issue with my glasses. Between my sinus and the fact that I really can't see, but we'll get through this. I've already submitted the budget. I submitted 2021 and 2022. Our fiscal year is from October 1st to September 30th. So we're now in 2022 as it relates to our budget. You guys have any questions about the budget? I'm here. If not, I can just give you guys updates. I'm proud to say since 2014, our agency has been categorized. We are no longer designated a troubled agency. And there are layers between trouble and standard. We are now considered standard. Financially, we are stable. We have exceeded all of the goals and objectives that HUD had in our corrective action plan. We have retired the debt of the $189,000 in our reserve. We had a reserve negative, and we are at 3.5 months in reserve. We have also retired the debt that we had from the DHAP money, which is disaster money that was spent inappropriately. We've retired that debt. The only thing that we still have on the board is the $600,000 from 2014. Realistically, the agency could not pay that back. But as a result of our streamlined conversion process, which we have submitted to HUD, we submitted it in July. I was expecting to have something back by now, but we are the first. So we're being patient on that. We've completed the tax credit application to support the conversion. We've also secured a syndicator for the tax credits, and we have a lender out of Alabama that does these all over the country. Highland is the name of them. But as a result of that conversion, what that transition does is the housing authority, as you guys know it, public housing, will become a nonprofit organization. We will no longer be a part of HUD. Our ACC will be discontinued. The development partner that was chosen, we negotiated with them to participate in the development process. So the agency, the nonprofit, will earn 1.4 or a little bit more millions of dollars. As a result of that money, HUD has agreed to allow us to pay in intervals. We will give them a percentage at closing. We will give them a percentage on progress, and we will pay off the balance on the when we complete the conversion. Housing Authority, HCV, I think that the way I was explaining it was confusing people. But Housing Authority, HCV, which is known as the Section 8 program, is not our program. That's HUD's program. We're the contract administrator. They give us a development fee. Well, they give us an administrative fee to administer that program. Housing Authority of St. Charles will continue to operate and administer that program. So we will have two entities. Both entities will be ran by the current commission that is appointed by the parish president. Did I simplify it? Or did I confuse it?
Ms. Cluley has a question.
Thank you, Madam Chair. Are there set numbers of vouchers for Section 8 housing, or do they vary? And
There is a set. We have a total of 373 vouchers. We had, because the numbers are changing, because we're porting out. A lot of damage, nowhere to rehouse them in St. Charles Parish. So if they're in New Orleans, Texas, Mississippi, wherever, we're allowing them to port out. So we have about 165 of those vouchers that are currently active. I would love to put them all to use. But in order to do that, it has to be a partnership with the community, the landlords. I've only been here 2.5 years. But historically, I understand that there were payment issues. So a lot of landlords backed off and didn't want to participate. We haven't had a payment issue to a landlord in 2.5 years. In fact, in September, all of our landlords were paid, even though the banks were closed, even though we were evacuated in Texas. But we work with First National Bank. We made a conscious decision to move from Capital One to First National Community Bank, and we were able to communicate with them, and they got all of our landlords paid.
do landlords need to contact your agency to be, like, available properties?
They
Or
can- they can-
is the client, your client, supposed to contact the
Or
landlord?
the landlord, because it's their property.
What's
So
that?
the landlord, as a result of COVID, the landlord used to come to our office, call our office to pick up an application. But as a result of COVID, we kind of automated everything. So on our website, the landlord can actually go on our website, fill out their application. You can use a cell phone, take a picture of the supporting documentation, upload it. Or they can call the office.
And where's your office?
Our office is located at 200 Boutique Estate off of Paul Mallard. I used to have the hardest time saying Mallard or DeSalmon.
Thank you.
You're welcome.
Ms. Fonseca.
Hi, Ms. Hollis. I know it's been a while since you came and gave your report, and you were due to give your report at the hurricane hit, so that got delayed. I'm interested in what your timeline looks like now, since the last time you spoke before us.
So the process is that we submit the application. When Ms. Belloc and my chairman, Mr. J, and I went to D.C., we were told that the application process would be a turnaround of 90 days, but it has to get to the SAC. Right now, our application is still in New Orleans. So the intent with New Orleans and their review of our application is to identify deficits so that we could resolve those deficits and have a solid application to send to the SAC. So once it gets to the SAC, if the SAC has a 90-day turnaround, because we've already started our pre-development activity, the bank, the underwriting process will take about 8 months. Cannot submit the tax credit application. I don't know, that's kind of great. We do have Wayne Nephew as counsel on the tax credit application. He does the bond for the state of Louisiana. But I'm not certain if it's wise. We can submit the tax credit application at any time because we're participating in a 4%. The 4% tax credit is non-competitive. So we in a holding pattern.
Right.
But once we get that approval from the SAC, we know we have a minimum of 8 months for the underwriting part of it because it is a large deal.
Right.
And that's where we are.
Okay, well, thank you for the update. I know it's going to be a long process. It's not unlike the process that we went through to get federal grants, working through the state and then, getting approval from the state, working out the kinks, as you say, and then
Right.
it going to the federal level. And this is, as you say, a large endeavor. So we thank you for your efforts on it.
And unnecessary because our structure is substandard. As a result of Hurricane Ida, we had devastating damages. It exceeds $4 million. I have multiple processes I have to go through. I cannot use HUD money on it. I'm working with Gallagher, who's been awesome. Gallagher, we were able to file. We were able to file by September 5th. Our insurance claim. We were able to have mitigation started the first week of September. And they were, they took care of the contractor that my development partner had to come in from Sweetport. So Gallagher, as a result of them, we were able to get a consultant. So we have a FEMA consultant that's being paid for by the state that's helping us through the FEMA process. And we're working with the FEMA office in Alabama that is helping us to deal with the deductible. Huge deductible. But what they're doing is they're giving us credit that we have spent already. They're giving us credit for everything we did for the evacuation. And it's been simplified because of that consultant and because of our insurance company. I know y'all not used to hearing that right now about insurance companies with the hurricane, but Gallagher's doing an awesome job.
Glad to hear it. Thank you.
And I want to thank Parish President and the council for helping us get our people to Houston. And I also want to brag on the Housing Authority of Houston. Oh my God, they took such great care of us while we were there. We also partnered with Greenhouse International Church, Pastor Dekbar. He actually had a family from the Salmon that they're housing right now. They went and got him. But they just took really good care. When we came back on the bus, the undercarriage of the bus had so much stuff that was donated, enough to share with all of the residents. And then I need to deal with LaRon. LaRon and I actually serve on his board. We had already started an initiative to mobilize the community. Right before the hurricane, we had cleanup day. We had amusement rides, we had entertainment, we had free haircuts, we had pedicures and manicures, everything free for the community, and we planned it. It was our plan to continue that. They just did another cleanup day in Hornville and in Boutique, not as extravagant as the first one. But I brought it up because he provided a truckload of food to us in Houston. So everybody in the parish, I thank the community, I thank everyone, but most of all, I thank you guys, and I thank you, Parish President. Any questions?
Any more questions from the council or comments?
So my allergies are killing me. Do I have to say for public hearing?
Maybe for a second or so, yeah.
Okay. I thought you were going to deal with it. Thanks, everyone.
Thank you, Ms. Hollis. St. Charles Community Health Center, the brief annual report. Mr. Mark Kaiser.
Uh-oh, I'm not Mark Kaiser, no.
Oh, that's the name they got up here, Mark Kaiser.
Right. So Mark Kaiser is our Chief Executive Officer. Good afternoon, council members and Mr. President. My name's Shatriyan Kanger. I'm the Senior Vice President of Population Health with Access Health Louisiana, which operates our St. Charles Community Health Centers and school-based health centers in the parish. I just want to add tremendous amount of effort going on here in the parish. It's amazing, and hopefully what we share with you today will just continue to add to that and support the residents of the parish. I'm here today with my colleagues, and just to let you know the order we were going to go in, I was going to share some updates about projects we have going on that are exciting and we wanted to share with you. But I do know that this is a budget hearing, so we have brought along backup for the actual budget numbers, right? So that being said, we did have some slides. Just while that's getting going, you can go to the next one. I wanted to just kind of start and just give you an update with where we were at in terms of just encounters and serving the parish residents. So this is just a roll-up of kind of the trend leading up to Hurricane Ida and where we were at in terms of our volume. And you can see we were kind of on an upward trend throughout the year. And then, of course, kind of got halted with the storm. And I'm happy to say that we're bouncing back. And we're back up to about 80% of where we'd like to be. But we have some exciting projects underway that I'm going to talk about and what we're doing around that. Can we go to the next one? So it's not all bad news. During the storm, we actually got some really great news that I wanted to share with you. We were actually recognized by HRSA as being one of the health centers nationwide that was recognized for being a COVID-19 data reporter. So what that meant was that they were constantly asking people to submit surveys and data around our COVID-19 efforts, and we responded to and submitted data at least 90% of the time or greater. So I would say for us it was probably 100%. So that was special, and it was the first year that they were doing that, obviously, and we were proud to receive that honor. And then the two certificates on the right are also recognition from national programs. It's from the National American Heart Association, American Medical Association. We got a gold level recognition around cholesterol management for our patients with cardiovascular disease. And then we were recognized at the silver level for our care for getting our hypertensive patients' blood pressures into control. And of course, we want to get to the gold level, which would be, I'm going to talk about some projects we have underway to get there, hopefully in the coming year. But we were really excited, and we shared that with our care teams. As you know, it's been a tough year, and so for them to get some recognition like that for all the great work that they're doing, trying to keep patients in control despite all the crazy circumstances we've been going through this year, is a tremendous recognition. So yeah, I'll start with the picture on the right, just continuing what I was talking about with our innovative programs around supporting blood pressure control with our patients. So this is a program that we actually received some federal funding for that makes it available that we can give blood pressure cuffs for patients to monitor their blood pressures at home, regardless of their ability to pay. And what we do there is when we first started this program, I want to say right around January of this year, we were trying to do home deliveries. And as you can imagine, there's a lot of coordination, got difficult, and especially with the hurricane, people have been displaced. And so it was a goal of ours to be able to launch in-clinic kit distributions. And so we have started that just about 2 weeks ago now, that we've started in-clinic kit distributions at our Luling Clinic with giving those blood pressure cuffs out now. And then another exciting project I wanted to mention, and this has been years in the making, but I'm very proud to say that the St. Charles Community Health Center, among some of our other health centers in the Access Health Network, were the first health centers in the state to go live with a bi-directional interface to the Louisiana Immunization Registry. So the statewide immunization registry, it was a feature that was kind of historically only available to hospitals, that they had that feature. And so being an ambulatory care provider, a community health center, we're the first community health center in the state to go live with that bi-directional interface, which means that it streamlines the process for our staff when they're trying to pull in a patient's historical immunizations into the patient's chart and record. So as you can imagine, for children or for us to get a better sense if people have had their COVID vaccines outside of our network, things like that. So really exciting news. I think there's going to be a press release around that as well. So more to come on that. And then I wanted to mention a plug for our behavioral health services. Jan Kosofsky, Dr. Kosofsky couldn't be here today. I'm presenting on her behalf, but a lot of exciting work going on there where they've been evolving their service model. As you can imagine with COVID, they were kind of, most patients really enjoyed having virtual services, and then we were trying to move towards more in-person services right before the storm. And then with the storm, we kind of bounced back to virtual services again, which came in handy that we're able to do that and that we could continue and have that continuity with patients after the storm. But now they're back to moving into a hybrid model where they'll be able to offer in-clinic patient appointments if a patient would prefer that, as well as the virtual service appointments. They're also working hard to expand their behavioral health care teams, where they're adding behavioral health specialists into our call center so that if patients are calling in with behavioral health conditions, it can streamline how they get connected into services, as well as we just recently launched our medication-assisted treatment program for patients dealing with opioid addictions. And so I actually was in the room with one of our providers while I was on the phone with them. But when they got the call about a patient that was in need of our MAT treatment. And so he was really excited, and they were really thrilled to be connecting that patient into care. So with that being said, I'm going to turn it over to our Director of Pharmacy, Dr. Stephanie Thompson, who's also a St. Charles Parish resident.
Oh, my surprise. Good afternoon, everyone. As she stated, I'm a resident of St. Charles Parish. I've been for about 20 years. Kind of going over the aftermath of Ida, we knew we had to hurry up and get our pharmacy services and our clinics back online as soon as possible. With the generous availability of a generator, we were able to do that. Otherwise, it would have been weeks to get our clinics back up and, of course, our pharmacy back up. Because we're an open door pharmacy, we're allowed to take basically any members of the community. We did a lot of first responders, a lot of parish workers. We were able to fill their medications and really get them, the services that they needed while we were in the destruction and kind of the rebuilding phase of the hurricane. We unfortunately lost a lot of our team due to, being displaced, being in other states. Both pharmacists, myself and our current pharmacist that's on staff there, we're both St. Charles residents. And, we were dealing with, trying to get a tarp on the roof, deal with the destruction that was going on in the parish. But we both knew that it was very important to get our services online as soon as possible. That wouldn't have been possible without the help of you guys. If you want to go to the next slide. Our Luling Clinic and our Norco Clinic were able to start doing telemed visits and in-person visits as early as 8:31 after the storm. That was amazing. Our pharmacy opened on Labor Day on 9/7, and we were able to start getting services. We were able to get deliveries in because, of course, most of the medication that we received, that we had on our shelves, we had to discard just due to temperature and not having, AC for a couple of days. We worked in many different positions. I'm normally not on a counter in a pharmacy, but we were running registers, trying to do whatever we could to definitely assist the patients and the community of St. Charles Parish. Since the storm, we've been able to restart our COVID testing for our students and our teachers for our St. Charles Parish school system. We have a line that they basically call, we get them tested, and we send all of those results to the school. And finally, we do have our school-based systems that have been back online and are seeing children. They're doing immunizations, and they also have behavioral health services available and counseling available to those students. And also, community outreach was very important to us. Since our Norco branch was damaged during the storm, we set up our mobile unit. We were able to partner with the Red Cross and the Good Hope Baptist Church in Norco. We were able to distribute food. We were able to distribute supplies. And we were also, with the donations of Direct Relief, we were able to help support the community by refilling prescriptions on the mobile unit for blood pressure medications, diabetes medications, and things that, may have been lost due to damage, may have been in water. So we were able to really help and do a little emergency care for our patients and the community post-storm. So, now to the numbers.
So I'm Peter Torsch. I'm the CFO here. So before I respond to questions, if I could just discuss this first. So what we've done this year that's changed from past years. So in past years, so on this sheet we have shown our fiscal year, which starts on March 1, and based on some feedback I received last year. So these numbers actually are through December. So these numbers are 1/1 through December. So they're both for 2021 and our forecast for 2022. And then the next thing I just want to make clear. So you see at the top, so last year we did not show the taxes that we received. So I wanted to be sure and you show that this time. And these numbers are just for our two sites in St. Charles. So with that, I'll pleased to respond to questions.
Mr. Jewell.
I don't have a comment on the budget. I just wanted to comment and say thank you to Access Health for everything they did after the storm. I know a lot of times we reached out to y'all to send y'all's mobile unit into different areas of the parish, especially our hardest hit areas where we know that in even good times there's a lack of access to medical care, and we knew that was even more prevalent after the storm when people didn't have things like electricity or water for a couple of days. So thank y'all for working with us on that, and we appreciate y'all working very hard to get the pharmacy back up and running.
My comment was, correct me if I'm wrong. I heard you say that you did a blood pressure cup kit distribution. Is that current or that's ended?
No, it's brand new.
It's brand new. Okay. So what do people have to do to get a blood pressure cup?
Well, they have to be a patient of ours. They have to be seeing one of our primary care doctors so that they have someone that can monitor their blood pressure readings that they're doing at home. So that's key. And then they have to have a diagnosis of hypertension. That's it.
Good information to know. Thank you. Ms. Fonseca.
Thank you, Madam Chair. Peter, I want to make sure I understood what you
Okay.
said. You didn't change your fiscal year
Correct.
legally.
No.
You just changed how you presented it to us.
Yes.
Your normal fiscal
Yes,
year
ma'am,
is
correct.
July 1st to?
No, it runs through March 1st through 2/28.
Okay, so you just did that to make it easier for us.
Correct.
So, but both facilities do get other revenue besides the
Yes.
millage, correct? Grants
Yes,
and?
yeah, the cost to run, both facilities per year is about 7.2. And you can see the millage that we're expecting for this year is 935.
So the millage is only a small
Correct.
percentage of the revenue needed to run the
Yes.
facilities.
Yes.
Is the rest, like what type besides grants, what
You
type of
know,
other
we
revenue?
receive a lot of, federal grants, but then we also bill for, what, for our services too.
Right.
Where's that at, Michelle?
Is there any Medicare in there as well?
Yes, yes, we run about 60% CAID, about 10% CARE. And then our commercial's about 20%, and then the rest is self-pay.
So did you adjust the expenses? Like, how did you correlate the expenses with the amount of millage revenue presented here? Because obviously, if you're bringing in $7.5 million in revenue, you've got more than the,
Right.
unless I'm looking at,
So the way we
More than what's
do
shown
it is we receive the taxing payment, and we draw down specific cost.
you have a
for
cost
those
center
QSIs.
specific? I
Yes.
gotcha. Okay. Thank you.
Ms. Cluley?
Thank you, Madam Chair. I see it's based on your expenses and are expected to increase, or your budget allows for an increase of 3% based on the difference in what you expect to collect. And as you mentioned to Holly, this is only expenses that are allocated to the millage revenue, is that correct? And I'm thinking that the millage revenue may actually go down.
Yeah. So I spoke to you, Grant, about this. This was a number that we came up with.
All right. So that would be adjusted accordingly.
Yes.
All right, thank you.
Yes.
File number 2021-0159 is now open for public hearing. If there's anyone that would like to come up and speak regarding what you've previously heard, please do so now. Seeing none, public hearing is now closed. Any council discussion? No council discussion? The previous boards and agencies that have given their reports, you can leave.
Thank you.
Thank you. Council on Aging, brief annual report. Ms. April Keller. Everybody was biting. Can we get out of here, please?
Good afternoon. I do not have a fancy presentation to give y'all. For fiscal year '21, we delivered 104,068 meals to 613 clients. Our 5 buses provided almost 16,000 rides to 214 clients throughout St. Charles, St. John, Jefferson, Orleans, Lafourche, and Terrebonne parishes with the COVID restrictions. We couldn't load up our buses. They had to sit every other seat, so that's why those numbers are real low. We did reopen our Luling and New Sarpy centers on June the 7th with COVID restrictions, and we served 53 clients, 600 meals, recreation, and brought back our Walk with Ease activities. Our caseworkers assessed 193 new clients and reassessed 859 clients, and they had to do that all through our office over the phone. We provided 169 clients with almost 7,000 homemaker services, 31 clients with legal assistance, 714 clients with 45,000 material aid. 6 clients, we paid for them to receive the medical alert button that you press, help, I've fallen, I can't get up. 117 clients received telephone service. Since they couldn't go to the center, we had to begin calling them over the phone at least once a week, reaching out to them, making sure they were okay. We had 97 clients that received over 6,000 baths and personal care, cleaning. 22 caregivers received 1,311 hours of respite services. Any questions on 2021?
Ms. Keller,
Yes, ma'am.
I see under meals that your number increased. Well, you expect it to increase for 2022. So are you accepting new clients?
Are you talking about our budget?
Yeah.
Okay. Yes, we are anticipating more clients needing home delivered meals. As the years go by, we notice those numbers go up. So right now, we have 10 vehicles delivering up to 48 meals a day.
So you are currently accepting new clients?
We are always accepting new clients.
Great.
All they have to do is call our phone number, 985-783-6683. Right now, we are using still cell phones. We are waiting for Cox to hook us up. We had to move to our new Sarpy site because our Hunville location is totally damaged. And we are waiting to see if the school board is going to repair that building. We don't anticipate them repairing the building because we are in the process of building our own building. And hopefully by January 23, we'll be in our new building.
Okay. What about adult daycare facilities?
We do not have adult daycares.
You do not.
Our activity centers are for seniors to come and participate in activities, not for us to babysit. And since our Hornville place is damaged, we moved our office, our transportation, and our home delivery meal site into the new Sarpy site. And until our building gets built or we find a new building to house us, we will only have one senior center in the parish, and that'll be the one behind the hospital in Luling.
Any comments, questions, or concerns from the council? Okay. Thank you, Ms. Keller.
You're welcome.
(911) Communications District, brief annual report. Mr. Sam Zena.
I do not have an official annual report, but I'm going to give you a brief update on things. Good seeing everyone, and I know we've all been through some trying times, but with regards to 911, of course, we were fortunate enough to finish the expansion and renovation on the 911 center about 2 weeks before the hurricane. And we built it to withstand a Category 4. and we're glad we did that. Things went very well over there. We had some issues, but all I can say is thank goodness the operators were not in backup on the third floor of the courthouse. So God was looking down on us and everyone else in the parish, especially the operators, as far as that situation is concerned. With us having bunk rooms and the required bathrooms and showers and space and such as that, it worked out real well. A lot of the operators, just like everybody else in the parish, sustained quite a bit of damage, and them being able to be housed there for a period of time and not have to be concerned about that was really a big relief to them and the staff, because that wasn't another issue that we had to deal with. So basically, we are thinking our final payment on that issue there with as far as the expansion is concerned. And like I said, I don't have anything official, so I was kind of advised that not to take too long. So with that, if y'all have any questions with regards to the budget or any other questions related to the 911 center, I'd be glad to answer. And what I did do at the Monday night meeting is I appointed 3 members to Hurricane Ida After Action Committee, because there are different various things that we really need to look at, most of which is on really AT&T, how we can navigate through some of that as far as us losing our T1 lines and our communications and ability and such as that. But also along those lines, apparently that was an issue even before the hurricane with AT&T, and FCC actually has an investigation going on right now as to what happened before the hurricane, during, and after, as far as them being able to provide the services for the community overall. But we made it through it. Hats off again to the telecommunicators. They just did an excellent job remaining professional and even enduring all the things that they were going on in their personal lives as well, as everyone else. So if you have any questions.
Ms. Fonseca?
Sam, I don't have any questions. I just wanted to thank you for your patience and being the last one on the list today.
That's okay. I've got a lot of that. Because it doesn't do any good to stress. I have found out.
Mr. Jewell?
Sam, I just want you to pass on to the ladies and the gentlemen over at 911, just my gratitude for all they did right after the storm. Very tough to run a 911 center without telephones.
Yeah.
And obviously, we had some issues with our radio system as well.
Right.
But we appreciate them working and getting everything done, to respond to accidents. And we were hearing all the calls coming in during the storm. So
Right.
We just appreciate everything they do for us,
Yeah.
especially now.
And like I said, thank everybody for their support, but I've been saying publicly and even at my meetings and all that kind of stuff, and I knew it ended up being pretty expensive doing what we did as far as the expansion and the renovation, almost $1.7 million. But going through what we did, it's priceless. You just, we all know whenever you have a facility that's going to stand up to that type of wind and such as that, not really getting significant damage, it's critical. So I appreciate everyone's support. Thank you. If that
Any
was
more
all-
council discussion or comments, concerns? File number 2021-0159 is now open for public hearing. If there's anyone who would like to come up and speak regarding any of the items that we have discussed so far, please do so now. Seeing none, public hearing is now closed. Any council discussion? Okay. Okay, boards and agencies, you guys can go. Thank you. Go ahead, make a motion, whatever. Go ahead, make your motion. You want to make a motion to do it?
It's under general fund, the very first item. We already did this.
Got you.
Okay.
General fund, account number 001-400117, page 99, Council Division 6. 7. Representative Julia Fisher-Perrier.
Thank you, Madam Chair. Yeah, I'm actually last on the list. We almost forgot that one, but due to the fact that I wasn't here at the beginning of yesterday's budget hearing, I'll present now. My budget for the 2022 year is basically a standstill budget with a tiny, tiny decrease. I do plan to do what Mr. Dufresne did actually yesterday, and what the administration did with a lot of the money that we would usually do mid-year rollovers with. So I plan to take a chunk of my 2021 unexpended funds and move to something else. But before we do that, I'll just ask for your support on my budget as is. I'll make the amendment later because I'd like to go into this list that you guys provided us with from yesterday about the rollover projects versus the projects that stayed in 2021. So before I decide where I want to put my little monies, Miles, no here. Uh-oh. What's that? I mean, I'd rather not wait till Monday if we can start the discussion now. And maybe we can start it.
I can
Yes.
maybe answer some of the questions, and Mike can answer some of the questions.
That would work. We can just start it now and try to get the answers before now and then. I don't want to wait until the last minute to start having the conversation. So can y'all tell us what we have? We have two different lists that we have in front of us. Excuse me. None of them, this one doesn't have a title. Construction 2020, construction 2021. So are we looking at a list that were projects that rolled into 2022 budget?
Basically,
Yeah,
because I provided it
Yeah.
came from Public Works. What that sheet shows you is the first column that says, I don't know if it's blank or not.
I see the number,
Oh,
yeah. No,
okay, so-
2021, there's a column, 2022.
Right, that's it. So the first column, thank you, represents what's in the 2021 budget right now.
Okay,
Then you have your 2021 column and your 2022 column, and that's
Okay.
where we split the projects between. So in the 2021, that's the estimate of what we believe we're going to spend this year, so we left that in the budget this
Okay.
year. And what we're going to spend this year, we knew we weren't going to spend this year, we rolled into next year. So
awesome.
whatever is not spent in 21 in that 21 column will be rolled at a later time, but we tried to push as much of it into next year instead of having to do a giant one.
Okay.
You know, so that way we could start January without.
So if
any-
there's a number in the 2021 column, and there's no number in the 2022 column, we can safely assume
That it's
we'll
either
get
going to
it
be
started
done
or
this
it's
year.
almost done.
Yeah, and if it's not, then it'll be rolled, yeah.
Or rolled over? Because
If
if
it's
it's not,
not
if it doesn't
finished.
have a number in the 2022 column, it's not being rolled over.
Not yet,
Not now.
Yeah.
Now.
yes.
Rolled over into the 2022 budget, not through amendment.
Yeah.
Exactly. This budget in front of us. It'll roll over mid-year.
Correct.
Okay, so that's what that's to safely mean. Either it's started, it's almost done, or it will be a mid-year rollover. It's not in this book in front of us. Okay, so this is just for reference, I guess. This
I believe
other-
this is just our normal capital projects sheet that we kind of update on a regular basis for not only for the administration, but for our council members. And I think we also post this sheet online. So this shows projects that are either under construction, recently completed, or waiting to be completed.
And so how would this translate into the budget that's in front of us?
Well, I think this is just total capital projects on our books. Some of these projects, like I can tell you, for example, I think AMA Pump Station is on here somewhere.
Okay, yeah,
Is the AMA
second
Pump
item.
Station on this list, this other list here?
It's the second item on the first page.
Yeah, there you go. So AMA Pump Station, let's see,
It's under design.
it's actually about to be bid.
Oh,
But that one might not show up on this list. Let's see.
You gotta go to the drainage page. The first page is paved streets. So you get streets, sidewalks and crosswalks, and then drainage is the,
Drainage is our first page.
oh, it is, okay, I don't have one of those, so I only have the one I gave.
Oh, aim at drainage, let's see.
drainage improvements, 1,997,200.
So, for example, that project, we believe is gonna be let this year.
Which one are we looking at though? The second one, the pump station?
I'm just
upgrade
trying to
on
give you an
page one?
example of like the pump station project is one that we have budgeted for this year. It's like 1.8 million, I believe, is how much the project's gonna cost.
Okay.
We want to bid that project this year, or at least go to advertising this year.
Okay.
That's a project that if we go to bid, we have to have the money in this year. If for some reason we don't bid it, that's a project that will get rolled over.
Mid-year.
And,
Yep.
well, not even mid-year, even if we have to,
Point past the approval of this budget.
correct. Like if we go to bid that project, then
Through amendment.
we will do the rollover whenever we need to.
Through amendment, I guess, is the way we can refer to it, so we all kind of understand.
Yes.
Through amendment, rather than in approval of the budget book in front of us. Okay. That helps. I think, what I'm trying to make sure of is that something didn't get lost through translation, right? I want to make sure that the three different scenarios that a project could have, one, it was budgeted in previous year, it didn't get completed, it got moved into this budget. It was budgeted in previous year, it didn't get completed, it's going to stay there, possibly get done and possibly roll over. Or three, did it get cut, right? So we want to make sure that we're not missing something. And we have 7 districts, 9 councilmen. We have a lot of asks for each district, and just trying to ensure that. So I think this is really helpful in trying to figure that out. So I'm going to need to dig in a little bit. I have a couple more questions before I make my amendment. Actually, I may not even make my amendment now. I may dig into this after. My amendment's just about 20,000 from my budget.
Were you looking for like Primrose Canal? Is it like a specific project you were looking for?
Well, I mean, yeah, I have about 2 or 3 that I want to follow the trail on. So I'll dig in.
Okay.
I'll dig in. I do have a question about some funds, though, that we don't have in this budget. I know we did our resolution the other day relative to ARPA, American Rescue Plan, because we want the guidance to look different. And I know we want them to let us spend those ARPA funds more creatively. But I'm pretty sure we have some already. We have like half of the ARPA funds that we were supposed to get. And I'm pretty sure, are they reflected in the budget?
I believe so. Grant?
We did an amendment this year earlier for wastewater. It went
Already
to.
put it in.
Yeah, and the other half is in 22 for wastewater, because it was all,
Yeah,
it all went to wastewater.
It was 5 million, the council agreed to put $5 million into wastewater.
Yeah.
The first tranche of money.
Okay, so we did it through amendment, but the other half, we did budget?
We
the
didn't
other
receive
half?
it yet.
Yeah, we haven't received
That
it.
is, it looked like the wastewater projects were funded through something else when I looked at that.
Yeah, our total
Okay.
allotment from that was around 10.3 million, something close to that.
Pull it and see.
Yeah.
Give or take a
Half-
few $1,000.
Yeah, like 5 million each half.
Yeah, and that's the way it came down is in 2 tranches of money.
So we did put that 5 towards something already.
Correct.
For
And
wastewater.
and next May, we will receive the second tranche of the equal amount.
But we've budgeted in here, because I looked through all the.
Only the
I
first
didn't
5.
see it as a stream.
Only the first 5. I don't
No,
believe
we
we've
just-
budgeted.
the other 5
Have we
was
budgeted
on
the second 5 as
Water
well?
project here. I don't see it there. No, it doesn't have to be. Right,
Correct, yeah.
okay. That's what I'm making sure of. I'm like, I don't see where the second half is in. I didn't see where the first
It
half,
was
but it's not because we already did
pipelining,
it.
lift station improvements, and I think,
And that, if we don't budget that second 5,
yeah.
and we wait on the guidance, maybe we do get to do something different with it. Maybe we do. If they
Yeah,
change
and
the
I think
guidance.
which I'm not sure, we don't know what's going to pass, that other bill that's going to pass, if it's going to pass or not, or what's going to happen exactly with that.
Yeah.
Because I heard that they were looking at taking some of those funds to put towards a spending bill. So that money might be used for something else. It just all depends. But if they do allocate that money down to us, whenever that comes down, whenever we would receive that, we would just reflect it in the budget whenever we would receive it.
Okay.
And the council would be able to appropriate that money anywhere they would like,
Okay. Yeah, and I asked because
within reason.
you mentioned Primrose, that's something that's it's gonna take some money through the years for us to complete the project. And I understand that it's a phase type idea, which is fair. But I just couldn't quite decipher what happened to that project and where it went. And I budgeted $1 million last year. And I see it in the list you just gave me. I haven't even looked at it yet. So I was thinking if there's an additional $5 million that we're gonna divvy up, let's
Yeah.
start divvying it up now. But we really can't, and we won't, and it doesn't have to be in there because we don't physically have that money yet. How soon are we gonna bond out Go Mesa?
Well, I guess our intention before the storm hit was to sit down with the council members, review the projects for the East Bank and West Bank that came out of the Drainage Master Plan, and basically present the council a list of projects we wanted to start doing, because we're looking at about $12 million, us being able to bond about $12 million for Go Mesa. We are trying to get into a position where we can kind of get that back in front of the council and start showing those projects and show which projects we'd like to do, because the clock is ticking on us to be able to bond Go Mesa.
No doubt.
Not that we wouldn't be able to bond it sometime next year, but we are anticipating that our revenues from Go Mesa are going to decrease. And your ability to bond Go Mesa is based off of your previous payment. So if we don't bond it out before April, is it March, April? Before April, the amount of money we would be able to borrow would actually go down. And remember that if you bond Go Mesa, if the revenue source goes down, you're not on the hook for it. It's a high-risk bond for the investor, and if we got $0, we don't have to pay $0. I mean, we don't have to pay anything. I mean, we are merely a pass-through. So we still do want to bond Go Mesa, and we want to work with the council members to kind of spread those projects around to the portions of the parish and kind of get the biggest bang for our buck as far as those projects go.
So those projects, any of the projects that have come out of the drainage plans are not included in this budget? There are no
No, because
projects in the
we haven't even accepted a final version yet of the first. That was our plan, is in the beginning of September to meet with y'all,
Yeah.
to show y'all the draft before we brought it to the public as a final copy, and adopted it as our master plan as a council.
So those of us who may have some things that aren't in here can hope and pray that maybe that 15 that we get, the projects that we feel are necessary in our districts may be a result of the drainage plan, may be in conjunction with the drainage plan, and can be budgeted after the fact, after we bond out the money.
Yeah, and yes, absolutely. And if we look at, like I said, we will work to try to get the drainage master plan in front of y'all before the end of the holidays, certainly. I know it's going to be a little bit tougher to work with everybody because the holiday schedules get a little crazy. But some of these projects that we're looking at, me and Lysandra have talked about them. Some of are $1 million, some of them $1.5 million, some are $3 million. So there is the potential, if you get $12 million, we already have about $3 or $4 million of Go Mesa in the bank that we've just collected and held on to. You can roughly have around $16 million or so to play, $15 to $16 million.
Good.
And then obviously we have the ability to bond against our road and drainage. That's a sales tax, or is that a millage? We got a sales tax and we got a millage.
Exactly.
There you
Road
go.
maintenance is the millage, and the sales tax is the drainage.
So we can bond against our sales tax too on other things. But that's going to be a decision from the council. We have to kind of present y'all what we would like to do. And if you all agree with it, we are willing to do what we need to do to fund those projects.
Okay.
Like I said, we want to make sure that, and I guess you'll see when we present it to y'all, they are listed in priority according to the engineer on what kind of gives the biggest impact, what creates the biggest impact for that drainage watershed.
Okay. Okay, so there's 15 million that we'll be seeing in the near future, so we have to keep that in mind when we're looking at this current budget. If we bond it out, let's assume we bond it out. if we don't, that would be,
And remember, before it goes to the bond commission, all that, I think we have to be very specific. We can't just say
we have to have
drainage improvements.
projects.
Yeah,
No,
you have to say.
projects.
And
Yeah.
you can change the projects with a little bit of paperwork, but you have to say what projects you're gonna do. And then I think you have to have, kind of a test that you'll be able to reasonably complete the projects within 3 to 5 years, I think it is, 5 years. So that's kind of the stipulation on it.
All right, well, we're gonna go back to Primrose Canal. So it's on this list, and it has money budgeted for 2021, but it does not have money budgeted for 2022. So does that tell me that it's gonna be complete by 2022?
Are you on the very last page?
Yes.
Is it the 95,000?
So it's split up. No, it's about a third of the way down. Primrose Canal cleaning, which is $184,000. Primrose Canal stabilization, which is $679.
So I don't believe that project.
150 is what,
So I don't believe that project is engineered yet. We started doing some engineering in-house.
Okay.
Not engineering, but putting together our plan, and I think the Public Works Department met with you out in the field on that.
they did, yeah,
We
we walked it.
We did do the cleaning.
The cleaning is cleaning is what we can scratch off that it's done.
Well, we've cleaned the canal after Hurricane Ida, but I don't think we started the cleaning that we had prepared, which was
Right.
getting the muck out of the conspans.
We cleaned the trees out.
We
after
cleaned the trees out and then
after
kind of reswaling
Yeah.
that
So
canal.
the survey is done.
Okay,
We cleaned up the debris that was,
Right.
we did not remove any tree balls or anything that will probably ultimately have to be removed.
or beach balls.
Beach balls, bicycles, tires, everything's in there, right? But once we get this, the survey's done and we have our contour, what we want it to look like, then we're gonna work on the final engineering, and it'll be broken down into those phases that are priority. As far as the sheet piling goes, we'll design the entire project.
Okay,
That will be designed next year, or, coming
All right.
into that year.
and as we know, this money that's budgeted, $507,000 left, or moved, well, 507,000 is budgeted in 2022. That's not enough to complete the project. No, not probably.
No, you're looking at, for the entire span, if your intention is to sheet pile the entire span, $6-8 million.
Well,
probably.
part of what I was trying to do last year is just to get the ball rolling. And I think it can be a working plan and a movable plan and movable target, because I don't necessarily know if each section that we talked about needs sheet pile, but we need to talk about what the plan looks like, so I know how much do you think the project's gonna cost total, so. All right, that'll work. I'm gonna hold off on my amendment as well, so. That's it, my budget's over.
Okay. Ms. Fonseca?
Thank you, Madam Chair. I did ask for the documentation prior to the last budget hearing so that I could review it and make sure that the projects were there were no cuts, what needed to be rolled over was rolled over. I did find a few discrepancies, some of which I mentioned yesterday. One was the Old Luling Booty has been reduced from $850 to $439, and they're going to get back to us on that, I believe. The escrow issue, which was resolved, the park duplication. There were, I don't think, anything else that I noticed that was out of order. But also at the same time, there was really not much new in the budget, new projects wise. It's a really, in my opinion, and I talked to Grant about this yesterday, it's kind of a bare bones. We used to see new projects in the next year. And I think, part of that is a result of a rush to put the budget together because it was delayed because of the hurricane. But there is revenue missing, which you mentioned with the, our ARPA funding is not recorded in wastewater. But again, that expense, it probably is not recorded offset either. So it can be done later. But as far as the FEMA reimbursement for the storm, we have a lot of expenses that are recorded that we don't have that revenue to offset, like overtime from the storm, and that's a good chunk of money. So, that's a segue into the bonding conversation. Is we have a comprehensive annual financial report that's delayed because of COVID and the storm. So we don't have yet, here we are in November, we don't have the audited financial picture from 2020 yet. And then we have a budget that, really doesn't include a lot of things that we're talking in conversations about. From a bonding perspective, I am concerned when we're talking about bonding for wastewater, which we do have funding, not bonding for wastewater, but we have the ARPA funding for wastewater, but talking about bonding for public works, maybe bonding against the general fund for a potential joint venture with the library. So, we need to really understand the financial picture and the revenue that we do have before we approve bonds. We don't want to extend. And I know the attorney would look at that, but the council needs to be comfortable with that as well. I guess the parish government has always taken a real conservative approach to bonding, and we're talking about a lot of bonding, so that's on my mind. But I just wanted to let y'all know I did look at large, and I'm responsible for all these districts, so I do look at all of it, the perspective, and made sure that the projects were there, accounted for. My other thing that I spoke to Grant about was a couple of minor errors that need to be corrected. So I was going to go ahead and make a motion for that. One of them is in the general fund revenue summary statement, the revenue for weed and grass cutting was overstated. It was just a carry down of the line on top of it that got stated twice. But that will reduce our general fund revenue by $400,000. I think, Grant, you can give the specifics on that one.
Yeah, and we apologize and we appreciate Ms. Fonska for bringing it up.
It happens.
It was just trying to rush to get everything done in the last minute, and we obviously overstated the grass cutting fees. We replaced those with the ICC building code fees, which that went in there twice. So it was just a formula that messed everything up. So what we need to do is it's two parts because it's showing 2021 and 2022. We need to reduce the projected ending general fund revenues for weed and grass cutting charges by $410,000, and also reduce the 2022 general fund revenues for weed and grass cutting by $380,000. That's the first part. There is a second item. Parish President Jewell was able to speak with Sheriff Champagne and get him to agree to reduce his budget for the housing and maintenance of prisoners by $400,000, so the hit won't be as hard, and we do appreciate President Jewell doing that, and also Sheriff Champagne for agreeing to reduce that. So it's kind of a two-part amendment. So we have some reductions in revenues, but we also have some reductions in expenses as well. And I can read those again if you would like.
Chairwoman?
You don't have to.
Chairman, if I may, I just want to say, on the reduction of the money that is used for feeding and maintenance of prisoners, that is a statutorily required expense for the parish. So they're anticipating, I think projection-wise, it looks like about $800,000 for this year. Grant had already cut that for this year. I spoke to the sheriff, and he graciously agreed to roll that back, or allow us to roll that back. But I just wanted to make the plug that if for some reason that in reducing it will put him at about 1.1 million. So he does have some wiggle room in there. But if for some reason there were extra inmates, we would be required to make a change in the budget to pay for that. So just want to make that clear.
Ms. Cluley.
Thank you, Madam Chair. The reduction in the sheriff's feeding, that was in the 2021 budget or the 2020?
22. It's going to be
Okay.
this one because he's got 1.5 million or 1 million.
Yeah. So I was looking at pulling the balance of what he has in his 2021 budget, about 500,000 of that.
Oh.
How much is left total?
He's got 800,000 in there right now. So you want to be.
So you already reduced it.
Yeah, we reduced it already.
So our numbers don't show that.
It shows 800,000. If you look at,
What's the unexpended for 2021?
The budget was 1.7 million,
For 2021.
yeah, hang on one
and
second.
it shows that the projected result would be 800,000.
Now, I'm referring to one specific line item, which is his largest line item. That is his feeding and maintenance of prisoners. We show it as projected ending at 800,000.
It was 1.5.
So you've already pulled out,
He had 1.5 there as well. We reduced it to 1.8, 1.7,
no, he had
I'm sorry.
1.7,
And we reduced it to 800, correct.
so that's already gone.
Correct. We reduced it.
It's already,
Went
it's
to the general
already
fund, yeah.
in the fund balance.
Yeah, so it's already filtered.
Yes.
That was done before this.
It's already on here.
Because we
No
looked at
change.
where we had spent so far.
So we need to add that amount back to our
No.
8 million and some change?
Mm-mm.
Ours
No.
reflects a different number.
What we're doing,
2021 is already accounted for in these numbers.
Yeah.
There's no change to 2021.
the 22 number is what.
I'm requesting to change the 22 number to bring that into the general fund.
And
So
she's
that's,
trying to tap into 2021.
But that.
It's
Oh, we've already done
It's
that.
already been tapped.
And 2021.
So all of these numbers, if, whatever the projected actual result at the end of year, that's what your budget is already adjusted to?
Correct. That
In
represents what we
all-
think we're going to spend,
In
yes.
all,
In every account that you look at, that projected ending is what we expect to spend.
is that what
in
you've
year.
already got it
And
down
then whatever we don't spend will be rolled over, but.
And
that's-
unfortunately,
to? They did.
Good try.
I'm gonna research,
Amon was gonna be the biggest district in this parish.
no, not only, yes.
Sorry.
Yes, I had found an acorn, so,
Found the tree.
I'm gonna keep looking.
400,000 for 22.
okay, so we have a motion on the floor to,
Yes, we're going to reduce 2021 projected ending general fund revenues by 410,000 and reduce 2022 general fund revenues by 380,000 for weed and grass cutting charges. And then we're going to reduce account 001-410-100, sheriff, feeding and maintenance of prisoners by 400,000.
so the net effect
You'll be
is
left with the general fund.
a $380,000 reduction.
390, yes.
Oh, the 410, gotcha.
Yeah.
Okay,
So the general fund balance after this amendment will be $7,756,669. So that's $756,669 above the
did everybody hear that?
minimum reserve.
So right now, we're at 756,000 above the 7 million for the general fund balance.
Whoa,
After these corrections.
we're only 756,000 above 7? So we're
Yes.
7,756,000.
Yes, without recording or finding additional revenue.
the biggest chunk of the general fund that is normally not in there went to us budgeting to pay for our insurance deductible. We have a $3.9 million insurance deductible. That was by far the biggest chunk that we had to move this year, that we normally budget. Grant, what do we normally budget? About $1 million, $1.5 million?
$1.5 million, yeah, and that's combined for auto and general and property, so.
So, okay. And back to the FEMA money. From what I understood, 90% of it is covering the first 45 days.
First 45 days.
100% for the first 45 days.
100% for the first 45
Yes.
days of expenses, which is going to really cover
Oh, yeah.
the bulk of
big-
the
yeah.
category A, category B.
Correct, the all your labor and
Yes.
those costs.
And then 90% thereafter.
Correct.
So almost the bulk of all of the storm expenses are going to be reimbursable.
Yeah, it's just when
So,
we
but
get
the
them
revenue's not here, so there is more revenue
to come.
to come.
And it could be a year or more, unfortunately. Hopefully it'll be sooner.
It
but
can
we
be
don't know.
recorded, though.
But let's go back to the amendment that we just made that dropped us down below $8 million, because we were above $8 million before.
That's
that.
right.
Correct.
Yes.
Right.
So let's do it again. Let's
Okay.
go line by line with the amendment that we just
All right.
did.
I'll,
400,000.
410,000
410,000
out of 2021,
out of 2021.
correct, projected ending,
Okay.
general fund revenues. And then 380,000 out of 2022
Revenue.
revenues, yes. So that's your reduction there. And then we're reducing the sheriff, account 001-410-100, feeding expenses, which is a plus, because that actually goes up by 400,000, which is a net of 390.
I made that request, so the hit to the
That's
general
in
fund wasn't
21?
as large.
Because with that, not minor, but error,
Yep.
it would have been a much larger hit.
Tell me again why we removed these revenues?
Well,
was
we
an
don't
error.
expect to collect 400,000
That
in
she
weeds and grass
accidentally
cutting.
carried the top line down.
Oh, it was a key punch error, like when they were
Key
it was a
punch.
key punch error when we were putting everything in. You just saying why we made the error, or, yeah?
No. It's just an error.
It was an error, yes, it was an error. And we do apologize. Yeah, yeah.
Yeah,
Well, it was
if you-
right after ICC building codes.
If you
and
look
that
at
was-
the weed and grass cutting line, page 85, I want y'all to see this. About 10 lines down, weed and grass cutting. If you notice, like 2020 prior actual was only about 10,000, and then I'd actually looked back at 2019, it was right about 10,000. So when it jumped up to the 400 IX grant, where's the revenue coming from? And they, looking at the notes, they realized that the previous line, ICC inspection fees, was accidentally just duplicated, carried down. So it's just a mistake, but it needs to be corrected for accuracy of the general fund balance.
So you had a motion by you?
Yes, I'll make the motion to make the corrections. Any? I
Need a
don't know if
second.
she has any more questions.
Anybody have any more questions before we move on?
Okay.
Ms. Perrier, second the motion. Let's explain all that.
To reduce the 2021 general fund revenue by 410,000.
Thank you. The motion was to, let me put my glasses on. The motion was to reduce the general fund by 410,000. Correct?
In 2021.
In
For 2021. And
Reduce it. by-
reduce the general fund revenue for 2022, 380,000.
Correct.
And then, 400,000. What's this, HS? What is that? For the sheriff expenses for 2022, 400,000.
That's it?
Correct? Okay.
The
Thank you.
feeding and maintenance of prisoners line item.
Your notes were better than mine.
I'm sorry.
No. it's- So everybody got it? Let's cast your votes. What? Yeah. For a total of
We don't really have.
7,756,000.
I said we don't really have choice. It's gotta be correct. It's not real.
And that passes unanimously.
Thank you.
Okay. That's everything? Okay. That's it.
Council members, are there any additional amendments that needs to be made? If not, Ms. Perrier?
I may make some amendments Monday. I'm not gonna pretend like I'm not. So I wanna look through all of this and just make sure that I feel comfortable with what's going on in District 7. I don't have any new asks from what I asked for last year. So I just wanna make sure that I feel comfortable with what that is, and I hope that the council and we can all support each other on what we need to do. I do wanna make a comment about bonding out money. So this Go Mesa, we're only one of 2 parishes out of all 64 that have bonded out their Go Mesa money. So I know we're very diligent and fiscally responsible, but moving forward, if we're one of 2 out of 64, there's probably a reason why we need to go ahead and do it. You know, and over 20 years, the projects that we pick, I think would make, you know, basically need to have a life. And I think that the administration will help pick those projects that make most sense for whatever that money is if we bond it out. So just a plug for that. And I'm just making sure I have one more tab that I don't know what this is. And let me see if I have a question I need answered now. Yeah. There's 800,000 in fund number 401, page 265. Wastewater sewer study master plan. Is this a rollover? And I'm sure it's on this list telling me what's going on. Is this a rollover? Did it come from 2021? 265. Or is this an additional 800,000 for the money that we've budgeted for these master plans so far? So that came from last year? Okay, just checking. Okay, that's it for me today. Thank you.
Mr. Gibbs?
Thank you, Madam Chair. I'm going to do a budget amendment for 2021 on my specific council budget, please, for the sake of not doing it Monday for time. I want to move, I'm going to go line item, and I'll do this quickly. Printing, item 220, business cards, miscellaneous printing, total of $3,150. 241 postage, postage stamps, mail-out postage, total of $5,700. Telephone, miscellaneous, and cell phone, it'd be $3,000. Rentals, get rid of these portalets, $700. Maintenance, property and equipment, multifunctional equipment, computer, printers, repairs, miscellaneous, that's $800. 270 contractual access to internet contingency, new provider, be $1,800. Office supplies, miscellaneous software, computer, file cabinet, desk, etc., iPad accessories, that is, bear with me, $675, $8,000. In 310 office supplies, miscellaneous supplies, multipurpose paper, computer supplies, that is $1,650. Food and clothing, miscellaneous, $700. Training and travel, police jury, NACO legislative conference, miscellaneous allotment, that is, looks like $4,200 with a total of $3,700. I mean, $30,700, I'm sorry. I'd like to move that to the Almont Splash Park for revitalization, repainting. We got some, a lot of graffiti that we've got to cover up. And wherever else Dwayne Foray might use.
Is that right?
Improvements other than buildings, Ormond Spray Park is fine.
Thank you. Appreciate you guys.
Mr. Jewell?
I think I need a motion to do this.
Oh, okay. Yes, you need a motion.
You
And a
can
second.
make the motion.
I have a motion by Mr. Dufresne and a second by Ms. Perrier to move, what district?
District 3.
District
That's the
3.
best one.
On the East Bay.
Yeah. There you go. David needs to make
Councilman
the
Gibbs
motion.
needs to make the motion.
He's making the motion.
I need a motion, please.
And Ms. Perrier is seconding it. Councilman Gibbs makes the motion, and it's being seconded by Ms. Perrier. District 3, Mr. Gibbs is moving $30,700 to the Ormond Splash Park. And you said that was buildings and
Improvements other than.
Improvements other than buildings in Fund 113 Recreation.
in 113, right?
113.
Okay, let's cast your votes. That passes unanimously.
Thank you, everyone.
You started something there, Mr. Dufresne. Good job. Anyone else like to do an amendment or any comments or? Mr. Jewell?
I just want to say, going back to Councilman Fisher's comments, so if any of the council members have questions between now and Monday, please reach out to us, especially like public works related issues, Mike and Grant, and we can answer any questions you have. And I also want to agree with you that bonding Gomesa has no financial risk to the parish itself at all. So I think it's a good deal, and we are only one of two parishes that have not bonded.
File number 2021-0159 is now open for public hearing. If there's anyone who would like to come up and speak regarding this items or any of the items that we have discussed. Seeing none, public hearing is closed. Any council discussion? Seeing none. Announcements. Ordinance introduced for publication and public hearing on Wednesday, November 15, 2021, 6 p.m., Council Chambers, Courthouse, Hornville. 2021-0159, an ordinance to approve and adopt the appropriation of funds for the St. Charles Parish Consolidated Operating and Capital Budget for fiscal year 2022. Adjournment. A motion and a second is needed. We have a motion by Mr. Gibbs and a second by Ms. Billings. Please cast your votes to adjourn. Councilman Gibbs? And that passes unanimously. Thank you. Have a great day. We are officially adjourned.